Here's what you missed from Glaucoma 360. I'm Carey Powers here at the Glaucoma 360 conference in San Francisco. Today, we're exploring the innovations in diagnostic testing that are transforming how we detect and monitor glaucoma. I'm joined by two leading glaucoma specialists, Dr. Aboobakar, a glaucoma surgeon and instructor of ophthalmology at Massachusetts Eye and Ear at Harvard Medical School, and Dr. Leon Herndon Jr., a glaucoma specialist at Duke Eye Center. Thank you for taking time to travel here and taking part in the meeting. Let's start by addressing the unmet need in diagnostics as it relates to glaucoma care. So, Dr. Aboobakar, could you share your clinical perspective?
Yeah, I think some of the issues are one is we have a lot of patients who are just not diagnosed with glaucoma early enough. We know from population-based studies that, 50% of cases go undiagnosed at earliest stages. So identifying these people before irreversible vision loss has occurred is critical. And then also we see patients a few times a year have kind of a snapshot in time in terms of their intraocular pressure or other imaging, and we don't have ways to monitor that outside of clinic currently in terms of most tests available. And so that would be another important unmet need.
Dr. Herndon, do you have anything else?
Yeah, I agree with us. I would say that we need reproducible technology that the patient can give you a good study. And patients tell us all the time about how they don't want to do their visual field tests. How can we make it easier for them? How can we make the technology smoother process? How can we take it out of the clinic and make it more efficient so we can use our time to do what we do best is, taking care of patients.
Very good. Well, today at Glaucoma 360, we heard about a lot of really impressive diagnostic advancements in glaucoma. So share with me, what are you most excited about in terms of what's on the horizon? Dr. Herndon?
Yeah. So we heard a lot about the portability of diagnostic testing. We talked about wearable technology with OCT. We talked about home visual field testing with Vivid Vision. We also talked about ways that you can take a visual field test on your phone. And so, again, getting at the idea of getting testing outside the clinic and doing it in the patient's home, they can transport that to you, and then you can make a determination there. So I'm really concerned about the manpower needs and woman power needs in the future, because there's not going to be enough of us
Yes.
to take care of the patients who are getting older with glaucoma, who are going to have more advanced disease. So we need to find ways of being more efficient and have the best use of our time. So I'm really excited about portable technology.
Dr. Aboobakar?
I agree with everything Dr. Herndon said. There's a lot of new technologies emerging to allow us to monitor our patients outside of clinic. And then the other exciting area is the polygenic risk score for glaucoma. And so we know that glaucoma is one of the most highly heritable diseases, but right now we really don't have a way to risk stratify patients based on that. But there are commercial tests that are becoming available to allow us to identify people who are at high risk before they develop disease. And so I think that's another really exciting area.
So as you think about these advancements that are coming down the pipeline, how do you think this might enhance patient care in underserved populations and advance global health?
I would say so. Cydex is one of the technologies that was mentioned in our session, where any computer can be a visual field machine. Your phone, your home desktop or laptop. So the colleague who presented the data is doing a lot of work in underserved areas in Southeast Asia and Africa. So he has a protocol in place where we can have technology that's portable, that's easy to perform, and that's readily available.
Yes, and I think that it doesn't require people. You can have people elsewhere looking at those tests as well if there are shortages of providers in those areas as well. And so I think that's important.
Yeah, remote technology,
Technologies, yes,
so we can continue to take care of more patients.
I agree. Yes.
Very good. So AI, machine learning are increasingly being integrated into diagnostic platforms. So how do you see these technologies impacting glaucoma testing and clinical practice in the coming years, Dr. Aboobakar?
Yeah, I think one of the limitations of studies of new treatments, especially neuroprotective treatments, is how do we identify the people who are rapidly progressing in terms of their glaucoma, and so we can, increase the power to detect differences with these treatments. And so I think that using AI algorithms to sort of identify the people who are most likely to benefit from these therapies will be really important.
Dr. Herndon?
Yeah, I think AI I'm really excited to see what technology has in the next 5 or 10 years because the technology is excellent. Right now, many AI algorithms are as good as a glaucoma specialist at predicting progression. There are good models looking at screening. I think our retina colleagues are further along than we are when it looks like using AI to do diabetic retinopathy screening, for instance. So we still have a ways to go in glaucoma, trying to use it as a screening tool. But I'm excited about where AI will help us determine which patients will do well from surgical technology, where surgical options, which surgical treatment might be best for that patient. So AI will help us to make a better informed decision.
Very good. Well, thank you both for taking time out of your practices to be with us here at Glaucoma 360.
Thank you so much.
Pleasure.
For more information on the Glaucoma Research Foundation's efforts to cure glaucoma, visit glaucoma.org.